Hello, I'm Dr. Natalie Diangani here with Dream Smiles Dental, and we got a lot of questions about emergency dentistry. Today, I'm going to answer some of the most common questions that you have about that topic and just see if you can actually just have a better understanding of what an emergency dentist is and why you need it. A dental emergency is anytime you wake up and you're having pain, discomfort, swelling, throbbing in any area of your mouth. If you wake up one morning and you're noticing any kind of swelling that is localized in just that area, or you're having any bleeding, any pain, anything sore, throbbing, or hurting you, definitely you want to get in to see your dentist as soon as possible. When you need to actually go to the emergency room would be if the swelling is just around the tooth. At that point, you can go see an emergency dentist and find one as soon as possible. But when the swelling actually starts to go to other parts of the body, like if you notice swelling on your neck, if you notice swelling, in this area just below the chin, if it starts to spread past the tooth and go into other parts of your face, that's when you definitely might need to see the emergency room. If this happens on a Saturday evening and you're unable to get to an emergency dentist and you're noticing that swelling is getting worse, then you will need to go to the emergency room. If you're having any difficulty breathing, if you're having any difficulty swallowing, those are definitely signs that the infection has spread to other parts of the body and it's a serious emergency. So in those cases, you need to go to the emergency room. Often when these cases arise where you do have swelling in the tooth, sometimes that tooth is able to be saved. Sometimes we're able to do something called a root canal on the tooth, which is a process of removing the nerve and being able to save that tooth. But if the infection is pretty extensive or the tooth is broken in such a way where we cannot save it, at that point, you're going to need to have an emergency dental extraction. So if we're unable to save the tooth, or we can look at it and see that it just doesn't make sense over the long term for you to keep this tooth, and we'll go ahead and we'll provide an emergency extraction. So kind of the same situation with anytime you wake up first thing in the morning and you are experiencing that swelling, you just come right into an emergency dentist. What we'll do is we will take a look at the tooth. We will take x-rays of the tooth and we'll be able to let you know if this tooth can be saved or not. If it can't be saved, we'll go ahead and do that root canal as soon as possible. And if it can't be saved and it makes more sense to remove it, we'll go ahead and provide that extraction. It's really important to me that we're able to get patients in who are in pain in as soon as possible, because the thing with dental emergencies is they only get worse. They only get worse over time, and the sooner that you get in to see a dentist, the better it is for you. So definitely, we always offer our patients same-day availability so that we can come in, look at the tooth, discuss what the game plan is going forward to get you out of pain and get you healthy. Yes, at our location, we do have late days. We do offer appointments as late as 6:30 or 7 p.m. on certain days. So definitely we can arrange that to just fit in with your busy schedule. We do offer weekends once a month at this location at this time, yes. So I hope I've been able to answer your questions about dental emergencies. But if you have any additional questions, feel free to give us a call at 832-995-0649. We're here to help.